Internal labour migration is an overwhelming reality that defines India's developmental landscape. Migrants are often disregarded by the privileged locals and are not given their due credit. Unfortunately, it took a pandemic for India to appreciate the quiet grit and contribution of the migrant workers in building the country. On one hand, migration gives people a way out from the distressed condition of rural society, but on the other, it also makes them a victim to the issues of urban-rural divide and exploitation, which prevents a positive transformation of their lives. They are excluded, unemployed, live in poor conditions and undergo emotional stress. Still, millions leave their villages and flock towards cities like Mumbai, which have better job opportunities. But life for them isn't easy, as they need to leave the comfort of their village and build a new life from scratch.
In many cases, the men are joined by their family in the city. However, the exorbitant cost of living in Mumbai compels one to live away from the city in neighbouring suburbs.
One such example of the abode for migrants is Naigaon, a suburb in the Palghar district, which is a part of the Mumbai metropolitan region.
Multiple padas make up Naigaon, which is spread over a 5-kilometer radius with a population of 9 to 10,000. About 70% of the population is made up of migrants from different states such as Uttar Pradesh, Bihar, West Bengal, Haryana, Rajasthan, Gujarat and Tamil Nadu. However, distance from the main city translates to a huge gap between life in the city and suburbs. Most men have low-paying jobs and women are unemployed. Hence, the dream of an improved life is not entirely fulfilled.
It is here that Human Welfare Charitable Trust intends to develop a centre for the community. HWCT India Foundation, spearheaded by Kalpesh Kabra, is a 7-year-old organisation. It primarily focuses on skill development, education enablement and employment in Mumbai and rural Maharashtra. The challenge of the NGO is to identify how it can empower the people of Naigaon. While NGOs can come up with a whole bunch of ideas, lack of a streamlined approach can result in failure. Hence, before designing the program, it's important to understand the people and its community, and this is where qualitative research comes into play. But the key question was, who do we talk to?
Since COVID, life has become extremely challenging and a single earning member is not enough for survival. There is scope for the woman to step up and be a contributor, as she is not overburdened with responsibilities of her extended family and society. Hence, women became the focus of our study, as we realized there is a need to empower the woman to empower the community, and this is where HWCT can play a significant role.
Given the developmental nature of the study, we approached it from a macro lens for community understanding and a micro lens to understand the people. We started with a community tour to get a macro perspective of Naigaon and spoke to experts across different fields such as health, education, governance and self-help groups. We interacted with the beneficiaries to get a micro perspective of their life. Let us now understand their life, aspirations, challenges and needs.
Since ancient times, women have been made to believe that they must be under the custody of the authoritative male figure in the family. Critical appraisal of ancient texts like Manusmriti also point towards this conditioning. Hence, compromises from childhood to adulthood are a given. Forced to give up education and get married at an early age. Once married, they are unable to resume education as are overburdened with responsibilities. And they do not have a say in most matters linked to their life. This deep-rooted conditioning lingers on despite being away from their village.
Although away from the societal gaze, she continues to be caged due to self-monitoring. As a result, there is a constant feeling of being held back, and their immediate environment makes them feel more restricted. Their home is a constant reminder of how grim their life is. Further, everyone around her seems to be in the same boat, and hence she lacks positive influence and the drive to bring any change to her life. The limited exposure confines her outlook and closes the door on the opportunities that lie before her and her family. She lacks aspiration for self, cannot provide quality education to her child, is unaware of work opportunities, can't handle finances, and fails to speak up about her issues even in extreme cases like domestic abuse.
Due to her restricted mind, she lacks a sense of self and is unable to be self-reliant in difficult circumstances. And being self-reliant is not high on her priority list, as she is consumed by multiple pertinent issues.
Health is a critical issue because Naigaon lacks the required medical facilities, and the consultation cost is also a barrier to seek medical advice. In fact, most of the people are ignorant with respect to health, which results in a lot of health issues such as no family planning, malnutrition, lack of personal hygiene, and trivialization of mental health. While health is not the key focus of the NGO, small steps can be taken to make the community more informed, such as awareness camps, movies, street plays, and habit formation drives.
They lack access to basic education as schools are far from their homes and they cannot really afford to pay the fees of private schools. As a result of which, most of the people who we spoke to are not even sending their children to schools right now. Children are not getting the right guidance as teachers are underqualified and lack soft skills. COVID too put a complete pause to their educational progress. Given that HWCT does not intend to start a school, a supplementary educational initiative holds less appeal as basic schooling needs are not met, but there is scope for the NGO to tie up with a third party to facilitate education programs such as digital education and teacher training.
With respect to work for women, there are multiple barriers such as low awareness, low willingness to step out of the house, and the constant worry about log kya kahenge. Some women are doing irregular work like fixing small stones on jewelry pieces. However, the working condition is not favorable. It is strenuous and low paying, which is why most women feel it is not worth their time. Paise ki tangi is their reality, but it only got worse during COVID as men lost their jobs and struggled to make ends meet. Women are extremely dependent on others with respect to financial matters as their financial literacy is low. Further, they do not even have a say in financial matters at home as the husband has full control over earnings and savings. Due to low earnings and high expenditure, they are unable to save much money. And whatever little money is saved inevitably gets spent. Hence, financial management really takes a backseat for the community because they are so caught up with their current financial instability.
The woman's point of view towards solving these issues observes more of a laddered approach, wherein she feels better education of a child will lead to more income in future, will be able to save for a secure and better life, and can then think of doing something for herself. However, our recommendation is to reverse the thought process by skilling the woman. It's important to make her see the domino effect, because skilling leads to work opportunities, which brings in money, leads to savings, financial management, and ultimately changes her outlook towards life. HWCT must focus on making women self-reliant through skilling and financial management as the two are interlinked.
It can change her life by making her independent, confident and capable, and it can also have an impact on the lives around her. The NGO must focus on skilling the women and providing them with employment opportunities, but it is important that the work is dignified, offers flexibility and brings in regular income.
Given the huge dropout rates usually seen in skilling programs, certain things must be kept in mind to design the program well. Uplift the group and not individual women, as she does not want to stand out as a hero but wants to conform. Use engaging learning methods such as storytelling, make the program almost like a ritual for her with some flexibility, incentivize her to make it seem worth her while, and tie up with entities to bring in work opportunities.
However, earning money is not enough. HWCT can help her manage money by improving her financial literacy. While a skilling program is relevant, it must reach out to the community in an impactful way.
The NGO must connect with her by communicating the benefits of the program, such as खुद की पहचान बनाना, जिंदगी में आगे बढ़ना और परिवार को साथ लेकर चलना. The NGO can position the center as the shelter of love, a safe space for the migrant community of Naigaon. While the fieldwork went off relatively smoothly given how forthcoming the community was, we faced few minor challenges during our execution. Some of the women we met were wary about interacting with us given the fact that they have less social exposure. However, we approached them through a local contractor who helped us overcome the barrier.
We faced a language barrier with some migrants who did not understand or speak Hindi. To solve this, we requested some Hindi-speaking women to help us with translations. So this was it from our end. We discussed the recommendations with HWCT and basis our findings, the plan going forward is:
our short-term plan is to start the skill sector for the women and then extend it to the youth. There has been a new learning for us with the need of the financial literacy, which we would like to plan going forward. For the longer-term plan, there has been a rethinking where earlier we wanted to start the supplement to the regular education, and now we would like to turn it into opening a primary school for the needy children.
While this is a study conducted in Naigaon, the qualitative approach towards understanding migrants' challenges holds relevance for other states in India. The first step can be to focus on migrant hubs in Maharashtra, after which it can be scaled up to a pan-India exercise. This project has been extremely special in our career as researchers, and we believe it will stay with us for a long time to come. This entire journey has been transformational for the NGO and for us as individuals. The conversations we had with the migrants of Naigaon made us privy to their challenges and has improved our empathy quotient.
It has also made us realize the power of qualitative research in bringing about a positive impact on the lives of the disadvantaged. Migrants play an indispensable role in the efficient functioning of a city. Their contribution must be recognized, and this research is a small step towards empowering them.